Very long morning. This is the December 14th, 2022 El Paso County Public Health Board of Health meeting. And so we have a number of our members here. Let's go ahead and go around the room. Let's see. General Briggs. Commissioner Cammie Bremer.
Here.
Let's see. Councilmember Dave Donaldson.
Here.
Dr. Vu.
I'm here.
Okay. Doris Walson.
Here.
I'm here. And Ron, let's see. Trustee Ron Stevens.
Here.
And Fire Chief. Are you here?
I'm here.
Okay. And Commissioner Lojinos Gonzalez is excused. He's at a CCI conference. So, we've got a lot to do today. We've got a lot to accomplish, so we'll proceed rather quickly through these next few steps. Approval of agenda. You have that in front of you, board members. If you would care to take a look at that. And if you like it, I'd entertain a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Okay. Well, this is a part of the meeting which I gain a lot from. I think, and I'll go last if that's okay. So let's just go ahead and go around the table here. General Briggs, any comments?
I'd just like to say thank you to the rest of the board members for support for the Board of Health's letter about the marijuana initiative, and the outcome I think is a positive one for the community. So thank you.
Well, there were a lot of hands in that pot, and so I'm glad it worked out. Good. Commissioner Bremer, any comments for us?
No, thanks.
No? Councilmember Donaldson.
Thank you, Mr. President. I would just second General Briggs' comments and then also wish everyone a Merry Christmas.
Nice. Dr. Bill?
No comment, please.
Okay.
I do have a comment this morning. I'd like to thank the El Paso County Public Health team for their quick response for the Club Q tragedy, and want to say that we need to embrace and love and have compassion for the victims and those who died and survived, and that we need to ensure that those survivors receive grief counseling as well as counseling for the trauma, post-traumatic syndrome that they're going to have forever, that they'll live with forever. And we just really need to wrap our arms around these folks. And my heart goes out to them. So, and thank you to the team here.
Nice and good. Thank you. Fire Chief Ted Colas.
Just this time of year is a great time for family and friends to gather, to be together, and playing off of what Doris said, there's some people in our community who don't have someone at the table this year. So let's keep them in our thoughts and prayers.
Nice. Okay, Trustee Ron Stevens, any comments?
Yes. As some of you know, I did not win my re-election campaign this year, so I just want to say this will be my last meeting here. My term ends at the end of this year. So I just want to say to all of you, it's been a pleasure working with you, and I've really enjoyed staff as well as the members of the board. It's been a pleasure. Thank you.
You bet. Well, it seems like it's been a long time since we met. Our last meet, we did not have a Board of Health meeting in November. We did have an educational session, and thank you, Susan, for that, for organizing that. I think that went rather well. Doris and I attended virtually the NALBO self-assessment, and if you're wondering what that is, that's the National Association of Local Boards of Health, and I think we'd have to agree we're doing okay. I think, not to put too much polish on it, but I think we were the head of the class. We were. We spoke out frequently, and this is a national organization as described, and there is a, if you will, a scorecard and I think we're doing pretty well. So, I would mention this book as interesting. This was from General Briggs, and as you know, he works with the homeless and the poor and the disadvantaged daily. And so here, this is not a book endorsement, but I would just say that I appreciate you suggesting this. I'm going to give that one to you. And we have an opportunity to learn from that book from behavioral economists. Okay? Let's see, Councilmember Donaldson, did you have a chance to say something? You said Merry Christmas, didn't you?
That's right, Mr. President, and I hadn't really looked at you until just a few seconds ago, and there appears to be something different about you. Yeah.
Yeah, well, my wife asked the same question, like, what's going on?
When did that happen?
That's a longer discussion. It's only facial hair, it
All
goes
right.
right away. Okay, thank you for that. And let's see, any elected officials in the audience? Sometimes we do. It's always good to say something there. Ron, your contributions, although brief, were significant, and I appreciate you. We appreciate you. We have a little something for you to say farewell and thank you for your service while you were here. So, Susan, you want to do that?
Sure.
You got to be on, though. There you go.
I am on. Thank you for your enthusiasm and your participation in the Board of Health. I really enjoyed all of your financial questions and engagement on the contracts and the budget. So I'm definitely going to miss that. And I wish you all the best. And I hope that we can still stay in touch and incorporate, what we're doing at different levels in the city of Monument, the town of Monument as well, with you also. And so we do have a certificate of appreciation for you, and it's on behalf of the Board of Health and El Paso County Public Health staff for service on the Board of Health from April 2022 through December 2022. And so this is something for you, and not sure, Michelle, if you wanted
Michelle,
to
should
take
we do
a
a photo
take a
op?
photo,
Okay.
and then share it later, or if you're interested.
Yeah. Let me add my comment, too. It's you and Dr. Vu who are the most eagle-eyed, I think, on all these documents and reading the contracts and all of the, and we appreciate that and keep us on the straight and narrow. So thank you. Thank you very much.
It's one on the backdrop.
Okay. Should we get him surrounded here, Susan? Yes. Okay. Switch over here.
Thank you.
And then we'll see you as well.
If that's the middle, I
Do you
think.
mind if we?
You're there. I'll bounce it. All right. Okay. Adapt and overcome, right? There you go.
Thank you.
Thank you,
Thank you
Joe.
so much, Ron. Appreciate it.
And Ron, the floor is yours, if you care to make any comments.
Just to reiterate my earlier comments, I just want to say it's been a pleasure working with all of you. I found the staff to be extremely professional and thorough, and working with all of you guys been a great experience. So I appreciate it. So,
Okay.
Christmas.
Well, thank you, yes, and Merry Christmas. Let's see, approval of the minutes. This was also in front of you. Board of Health members, you've had a chance to look at it. This is from a long time ago, wasn't it? In October 26th. So if you're happy with it, I'd entertain a motion to approve.
So moved.
Second? Okay, all in favor?
Aye.
Okay, number 5 is public comment on items not scheduled on the agenda. And so I understand we don't have anyone virtually, but we do have someone in the room. So please come on up, sir, and identify yourself. Let us know if you're with any organization. And yes, please limit your comments to 3 minutes. Thank you.
Good morning. My name is Stephen Walsh. I'm a resident of El Paso County. I continue to represent myself. On December 1st, I sent you an email in good faith, hoping to have an open and honest discussion on legitimate questions I have. I provided source documents supporting my assertions regarding the vaccine program in El Paso County, and I requested you to provide information that contradicted my assertions. Honestly, I did not expect the willingness to answer questions and have open dialogue, but the response I did receive from one of the medical directors was filled with only regime-approved talking points and did not further your goal of improving public trust. If my questions had been addressed, I would not have been inclined to speak today. Seeing that I received no information contradicting my statements, I am forced to conclude that my assertions are factual.
So we got to turn you on there.
Thank you very much.
Yeah.
That's a lot better.
Much better.
All right, so there is no FDA-approved vaccine widely available to the members of El Paso County. The response I received was that both the Pfizer mRNA for those ages 12 and up and the Moderna mRNA vaccine for those ages 18 and up are FDA-approved. This is a false statement, as evidenced by the business licensing agreement that I provided. It is true that FDA fully approved the Pfizer Comirnaty vaccine on August 23, 2021. Though both are affiliated with Pfizer, the BioNTech vaccine and the Comirnaty vaccine are legally distinct. If there is an FDA-approved vaccine, then a full package insert should be available, which has not been the case. If you can show me a Comirnaty labeled vial and the full package insert as required by law, I will gladly make a public apology. I stopped trusting any comments that came from public health leaders, and I know that I'm being misled on a daily basis. As an anecdotal story, when I called my life insurance company, I asked if I were to take the COVID vaccine and pass away, would my life insurance policy pay out to provide for my family? I was told that per the contract, if I voluntarily sign up to be part of an experimental clinical trial, that it would null and void my life insurance policy. The COVID vaccines are also not safe and effective. In my received response, I was told the preponderance of evidence strongly supports the overall safety for the vaccines and the benefits of vaccination far outweigh the potential risk. This is another blatantly false statement. I also provided a recent Washington Post article that stated 58% of coronavirus deaths in August 22 were people who were vaccinated or boosted, and this was according to a vice president at the Kaiser Family Foundation. This is only one of many pieces of information that I have researched. Additionally, Ms. Small, which is a Pfizer executive, she testified that the Pfizer vaccines were not even tested to prevent transmission prior to hitting the market. My assertion of lack of safety and efficacy is further supported by Rochelle Walensky's own words in July of 2021 that what we do know is the vaccines do not prevent transmission. So my question, how can anyone in their right mind continue to push the failing narrative that vaccines are safe and effective, and yet continue to push what is now the 5th shot for a variant that has not been prevalent for over a year? Another concern I have with the ineffective response letter is that no vaccine is 100% effective. So why did this body present the vaccine as a way out of the pandemic and push the messaging that would in fact be effective? One more minute, please. Thank you. Prevent the vaccine as a way out of the pandemic and push the messaging that it would be effective at preventing people from spreading the virus. So in conclusion, proper informed consent was also never provided to the population when they were scaremongered into receiving this product called a vaccine. I was told El Paso County Public Health is unable to provide any specific information regarding the informed consent process. I watched my taxpayer money being used to market and endorse mass vaccination clinics in parking lots, so there must be a standardized form to prove that informed consent was provided. In that the fellow citizens in this experimental trial before being administered the product. So in the interest of time, I will not bring up my other concerns today. I will, however, be providing additional questions to this body, and I hope that going forward, I will get the appropriate consideration and answers that my tax dollars demand. And I'm happy to answer any questions if you have them.
Okay, thank you, Mr. Wong.
Thank you.
Any other public comments? Yes, please. Go ahead and identify yourself if you're with a group, and please limit your comments to 3 minutes.
Good morning, Doctor. My name is Todd Evans. I'm the Deputy City Manager for the City of Paso. And our council asked for
Yeah, let's make sure we hear. No? You're looking good, we just can't hear you.
Trust me, I can speak up. I can speak up and let everybody know we're here.
President.
You got to be smarter than the switch, so I didn't have a chance.
Go for it, John.
Our city council asked me to come down and read a citation that was awarded to Miss Whelan last night. But before I get into that, I'd like to just share an experience, or a couple of experiences. Prior to coming into city administration, I was in public safety for many years with the county. And I just wanted to reinforce and thank all of you for what you do on the board, and just share an experience. The large public emergencies that I've personally been involved in go all the way back to the blizzard of 1997, where the collaboration in that, we had Fort Carson that brought out some Humvees for us, and we attempted to get to a couple on Fontaine Boulevard. Chief, you probably remember that incident. And we weren't successful. Tried all night and got to them too late, and they passed away on Fontaine. But it was something that everyone put all their resources into, made the best decisions that we could at the time, and did everything that we could. Moving on, was involved with the Hayman fire, the Waldo fire, but I wanted to share an experience with the capture of the Texas 7. So some of you might have been around when we did that. So I was the sergeant of the tactical team that captured the Texas 7 up in Woodland Park. And that day, we did a vehicle assault at the Western Convenience Store on Highway 24. And in just a few seconds, we had the first 3 in custody. Everything went great. Then we had a standoff with a couple that were up in an RV, a couple of the escapees. And I was personally up on the 2-3 corner on the perimeter. And we felt we had good perimeter, we had good tactical advantage at the time. And it went on for hours and hours. And we couldn't understand why. But what had occurred was we were collaborating at the time with the FBI. They were fugitives from Texas, so they had overall jurisdiction. Our tactical team was working with the FBI. So come to find out, we're up there, it's January, the weather's similar to what it is today. So you should be rotating people in and out, but we didn't have the resources to do that. We were assisting Teller County and the FBI. So come to find out that the reason we were sitting and we were waiting was the FBI was waiting for a tactical decision to come from Janet Reno back in Washington. And we sat for hours. And as we were doing that in the RV, you could see the individuals inside the RV who had over 50 stolen weapons inside the RV. They continuously came to the windows and were pointing their weapons at us and looking outside the windows. So many people were at risk while we sat and waited for that decision to come from a federal government in Washington. So we take those type of experiences, and of course that one ended up good. We took care. We lost one of the fugitives, took their own life inside the RV, but we didn't lose any of the good guys. And taking those experiences and moving them forward, when these type of incidences occurred that we just had with the pandemic, we, at least with our administration, our council, we sit down and we like to trust the experts. So when Scott Traynor and I sat down and we started putting an operations plan together for the pandemic in February of that year, we said, you know what, who are we going to depend on? Who are we going to work with? Who are we going to collaborate? And we're not the subject matter experts on a pandemic. We've never dealt with that before. So we depended on the board. We depended on the experts that you have here on your staff. And every question that we got, we sat back and we said, you know what? We're doing what's best for the region. And in Fountain, we have streets where on one side of the street, you're in El Paso County, and the very other side of the street, you're in the city of Fountain. Now we have Colorado Springs that's coming down all the way to Fontaine. So we soon will have 3 jurisdictions within a block of each other. So how confusing would it be for the citizens if we had 3 different sets of rules for public safety in that immediate area? So we determined that we were going to go with the subject matter experts, and we couldn't be more thankful with how everything worked. And you understand when you're making those decisions, whether it be in a tactical situation or a pandemic that you all handled for years, nobody's going to agree with everything you do. That's just the way it works. So we're very appreciative. And one of the things that our council wanted to do, and I'm going to read their citation, was to thank Ms. Whelan for what she went through for those several years and how grateful we are as a community for what she did. So if I could read the citation. Over the past several years, Ms. Whelan has been vital in the improvement of the overall health and livelihoods of the residents in the Fountain Valley. Given the increase in population in the area and high needs, her guidance and collaborative efforts are key in expanding access to services for people, including military families in Fountain. The opening of El Paso County Public Health South enabled those services to be expanded to residents in the area throughout COVID mass testing and vaccination opportunities, which provided easy access to Fountain Valley neighborhoods for healthy protection. Services through Mount Carmel were offered for a period, and WIC services continue to be offered with route residents without the need to travel north to Colorado Springs. Current other resident services include labs for water quality testing and pretrial services. The city has also partnered with El Paso County Health and shares an OEM room. And we also intend to house a public safety substation at that location, which will include officers for Fountain PD, Fountain Code Enforcement, and any necessary needs for El Paso County. Ms. Whelan has been a strong advocate for connecting people to mental health resources as public health conceptualized, pairing law enforcement with behavioral health experts, and a 5-year grant completed for the Sheriff's Office. City of Fountain has been able to create a Beacon Behavioral Health Connect Unit program. City continues to grow the program and expand its offerings by partnering with our successful Beacon program in the county. To not only provide services with city boundaries, but throughout all El Paso County. She has been an advocate for our future connection sessions between law enforcement and clients to build trust and relationships. And our continued focus on youth suicide prevention and youth substance use prevention has been impactful to our entire community. Our partnership with Ms. Whelan and El Paso County Health has been invaluable to the Fountain Valley residents and the city for many years. Throughout, Ms. Whelan has continued to not only update and debrief Fountain's mayor and city council, but has made herself available to other boards throughout the community. Her commitment, integrity, and leadership to serve this community has not gone unnoticed. We feel that a public health presence with meaningful collaborations help to improve community health and our quality of life. Therefore, we present Ms. Susan Whelan with the Spirit of Fountain Award. Sincerely, Sharon Thompson, Mayor of the City of Fountain.
Well done.
So we appreciate all that you do. We appreciate Susan, and without collaborations, there's no public emergency that can come out successful. So thank you all, but most of all, Susan, we appreciate you. Thank you.
Well done.
Thank you so much. Appreciate it.
Best time.
Thank you. I wanted to just share a little bit information about those that maybe do not know and how I lead as a leader. It's all about collaboration. And my efforts are not successful without a strong team. And I have intentionally built a strong team from a data analytics office to where we assess the needs in Fountain, the population growth, to determine where to place a physical building. I've had it in my vision for more than a decade to expand services with the vast land in El Paso County and the growing population. And it finally came to fruition actually in 2020. But that only happened with Board of Health support and a strong team, including our attorney. I mean, there was so many, back and forth negotiations and so many different details that so many team members were so critical to, and not only on the health department staff, but also the City of Fountain. I really enjoy working with the City of Fountain and the leaders, and I'm so inspired because when we face challenges, we come together and we figure it out, from the police chief to the city manager to the deputy manager to the council to the mayor, Mayor Ortega, the previous mayor, just phenomenal leadership and really impacting lives through teen suicide prevention, youth substance use prevention. And I got a little bit emotional last night with, what's been on my mind with the military community and the anniversary of Pearl Harbor. I showed up in the town council or the city council, and I saw a gentleman in a uniform, Army uniform, and as you guys know, that my dad passed away. I'll have an empty seat. And to be able to give back to the military community in some small way is huge for me. It's not just a job. I mean, this is really my passion in so many different ways. And so from the gentleman in the audience who was wearing a uniform and just the presence of the military, and I know that the police chief is a retired colonel, Chief Heber, and this was presented to me, and then you see that service on here. It's Pride Service, All-American, Hometown, and there's a big presence of military on here. And so with all of that, it was just very emotional with the community that we serve. We have a high military presence, and for me and my team to give back, through expanding services that are very meaningful, are just it's just wonderful. And my vision also for the future is that we do need to expand northeast. I mean, our population is growing so much. And then also not only have brick and mortar, but mobile. And we've completed in 2022 with our immunization program manager over 100 mobile outreach events where we go to people and meet them where they are to serve. And so I think that, what I told Fountain last night, we're only just beginning to expand services and what we can do in that building. We were set back because of COVID and some of the renovations and things that needed to be done. But just wanted to say how grateful I am. And my team. I mean, I cannot be a successful leader without my team, and that's every single employee on the public health staff. So, thank you.
Let's hold this up for the camera.
Yeah, and it has if you've ever had a coin, and I think many of you have, that you put in your pocket, this is super heavy. But it's just wonderful.
Well done.
Thanks.
Thank you. That's very, very nice to recognize that. All right, let's see. While we were doing that, we had Councilmember Tom Strand come in. So we'd like to recognize our elected official. Thank you, sir. We have next on the agenda Finance and Budget, Lori Cleaton, and we have several items to include approving our annual budget, which we've seen a couple of times. Lori? Can I speak up?
Is this on? Oh, there we go.
Better.
Good morning. What I have here first is the financial report through November. A lot of this is consistent with what we've seen primarily all through the year. Some of our revenues are running under budget, primarily in the ELC grant area, as well as program-specific grants. Those being under budget are primarily due to the vacancies that we've been seeing all year long. So if you look down to the expenditures, we have considerable underspending of $2 million through November in personnel due to the vacancies. And this is something that is not strictly a public health issue. We've been seeing it across the board in many county departments. So it's a big issue that we've been dealing with countywide. In addition, there are some capital underspending that we are seeing. We haven't had the expenditures that we planned due to a lot of delays in the contracting. So we are seeing capital underspending as well. Overall, through November, the net impact is about $2.6 million. This is a positive net impact, which we are anticipating will continue to the end of the year and show an increase to your ending fund balance. So our next report will be in February. That will give us a more clear idea of where the final 2022 numbers are, so, and as well as additional activity for 2023.
Okay, let's stop right there and see, are there any Board of Health member comments?
I have
Questions?
I have a question.
Yes, please.
For the grants, are those reimbursements?
Yes, they
So
are.
Where they're spend and then reimbursement?
Exactly. So where you're seeing the underspending in the expenditures, because that spending isn't happening, we're not able to draw down that revenue from those grants, is why the revenue is low as well.
Okay, any other comments before we transition? I'm sorry, did I interrupt? Were you done with that?
I only had one more statement. We did, based on some of the feedback that we had in the last meeting, we are working on some additional reports that will give you a more detailed month-to-month activity, budget versus actuals. It's not a report that we're going to present necessarily in each meeting, but we will provide it in your packet monthly.
Thank you. Detail is good.
Yes.
Appreciate it. Okay, any other?
That's all I have for that.
questions, Comments for Lori about the summary? All right, we have a number of contracts, and I think you're still up, right? You're going to be talking about the contracts?
A little bit, I'll give you a brief, but we do have people to represent
Oh, for
each contract.
individual ones?
Yes.
Okay, why don't you
So we
introduce?
do have one annual renewal for the sexual transmitted infection screening and treatment grant. There's been a slight increase in that contract.
Okay, let's hear from,
Summer South, she is our reproductive health program manager.
what's her name again? I'm sorry.
Summer South,
Hi, Summer.
and she's was in the military as well.
Hi, thank you. Yeah. So my name is Summer South.
I am the Reproductive Health Program Manager, and this is our annual renewal for our STI screening and treatment grant. It's a federally funded grant distributed through CDPHE, Colorado Public Health and Environment. The purpose of the grant is to improve reproductive health and prevent infertility by screening, diagnosis, treatment of infants infected with STIs. These funds support laboratory and medication costs necessary to appropriately diagnose and treat clients served at the Reproductive Health Clinic. We have served over 3,100 clients in 2021, administering 981 chlamydia tests, 995 gonorrhea tests, and 578 syphilis tests. And, the primary purpose of the screening and treatment of these STIs is to improve reproductive health, to prevent things like infertility, infants born with syphilis, and other complications due to STI infections.
Questions for someone, please, about this contract? Let's do them individually today, then. So without any more questions, I'd entertain a motion to approve this contract.
So moved.
Second?
Second.
All in favor?
Aye.
Aye. Thank you very much. We have another, this is a new contract, and I have here Carolyn Geary. Did I pronounce that right?
You did.
Okay. I got lucky. Go ahead.
Hello and good morning. Carolyn Gary, Development Officer. And I would also like to acknowledge Jordan Linder, who is our grants coordinator. We are definitely a team effort in this regard, and we are very excited to share with you an incredible opportunity. So with that, I would like to talk a little bit about the contract that you have in front of you that is part of a grant. This grant is through the CDC. And the full name is a mouthful, but it's from the CDC Centers for Disease Control and Prevention, Future of Public Health, Strengthening U.S. Public Health Infrastructure, Workforce, and Data Systems. So essentially moving forward, we are going to refer to this funding opportunity as really the future of public health because that is our focal area. So this grant, the purpose of this grant, it really came from understanding the impact that the pandemic had nationally on public health, and also illuminating how important it is to have a robust public health workforce at the ready. And as was already noted this morning, what we consider to be an emergent threat to our community really takes the many, many different forms. And so really being able to address that with agility is really incredibly important. And so when we look at nationally what has happened within public health as our populations have continued to increase and the resourcing for public health has decreased, we're really at an optimal time to examine this.
May I make one note before you
Yes.
continue? I want board members to know this grant is significant. In my 22-year career at public health, with this agency, we have never received this large of an amount for our agency. We've received $1.8 million, $3 million, but this is nearly $8 million. And General Briggs, when you ask about reimbursements related to some grants, it is on a reimbursement basis, but with this grant, they advance the funds. So all grants are a little bit different, but I did want to make the point that this is significant for the future of public health infrastructure, and it's a very, very big deal. So I did want to, before you lead into all of the other areas, did want to make that point. Thank you.
Thank you. And it is unprecedented. It's unprecedented in terms of the scope as well as the flexibility. And this was really intentional and by design, understanding that every local health public agency is unique to that community. And so it's imperative that we are able to address it as El Paso County, knowing what we know now, especially at this point, because as we address different emergent issues, we go through this whole whole response cycle of assessing what is happening, responding, recovering, and then assessing again and really learning from that experience. And that's exactly where we are right now. And so what's critical about this funding is that we're able to really leverage other sources of funding in a braided way to really maximize the impact of these dollars. Excuse me. All right. So the scope of this grant, it talks about retention, development, and partnerships within the notice of funding opportunity. I want to take a moment and I want to think about what it takes to sustain a public health workforce and really look at what it means to be agile and robust. So this is done in different ways. Yes, hiring is a component of it, but also really looking internally and understanding how do we grow and how do we support our workforce so that they stay with us for the long term, because that really just builds our institutional knowledge as well as our capacity to address different issues and the needs of our ever-growing community. So, as was noted, unprecedented funding. So for the A1 workforce component, we were awarded almost $7.4 million. And this is to be expended over a 5-year period. However, we do receive it all at once. So this is unique. The other component of this grant is really addressing the foundational capabilities of public health. So the focal point for our proposal really looked at the leverage point of cross-sector partnering, what we learned from being able to do that in a very orchestrated way over the course of the pandemic, and how do we continue that work, knowing that the more that we work within our communities and with our community partners, the stronger that we are. So within that area, we were awarded $452,000. So our total award is $7,830,856. So our funding timeline, it's 5 years. We actually have the funds now, so we can start to expend from December 1 through November 2027. And we are eligible. We are one of 2 counties in the state eligible for this funding to apply for it directly because of our size. And so our whole funding amount is determined, one, by our population size and also by our risk factors as a community that feeds into our resiliency index. So again, these are our funding amounts. This is where the funding is going to support full-time FTEs over the course of 5 years, and to also provide funding for professional development, as well as additional partnering opportunities and sustaining existing partnering areas that we have. So for those partnerships, some of the work that we've done over the course of time and that has really created great outcomes is through our embedded community navigators. And those are positions that have been funded by our CDC Health Disparities funding, and we're going to continue that effort through this funding. And that is just a rundown there. So that is for our CDC infrastructure grant, the future of public health.
Wow. Board of Health member question, please.
Can I just say praise God?
General Briggs.
I would echo that praise, but verify. So here's my question. Will it be possible for us in the future to be able to look at any specific measurable outcomes you're attempting to achieve through this money? And specifically, I will suggest, but this is not the answer, and I'm happy to have more conversations with anybody about this, something like turnover rate, and being able to tie programmatic effect through this funding to programs that reduce turnover. I'm just suggesting as an example that is one thing that can be measured. And I look forward in the future to maybe having some of those measurements, a dashboard or even just a piece of paper, fine with me, that says, here's how we're tracking quarter to quarter, year to year, obviously the long-term investment, see what the impact's going to be.
Absolutely. And as I mentioned before, what is really amazing about this funding opportunity is the timing, because we were also awarded through CDPHE funding to initiate and implement a workforce gap analysis that's going to provide many of those data points that you alluded to. And that will also inform this work. What is amazing too with this opportunity that we have now, this new one, is that we have a connection nationally to other agencies, and we'll be able to work on a data management plan that's intertwined with what it is that we're learning through that study.
And I also wanted to mention that, we have been working on staffing reports related to attrition, and we have our Human Resources Director here today, Xavier Frost, and we recently, during the pandemic, since our budget had nearly doubled from what it used to be related to the COVID response, and we needed to ramp up. Ramping up, we needed more support services, so we were able to hire a business partner from HR specifically for public health, and his name is Eli Pena, and he is currently working on attrition reports and really diving deep, because we partnered with the county on a staff engagement survey back in February of 2021 to get feedback countywide, but more specifically in public health around, what's going well for them, what's not going well. And then we're also having action plans to address that, as well as reading all of the literature around public health staffing and burnout, mental health related to the pandemic and being on the front lines, and what that has been doing. And so I look forward to having a more in-depth conversation either here in this format or a Board of Health retreat where we can really dive in to provide some perspective, because we have a lot of comparisons, but I know that Mr. Colas has brought up before as well, tell me what the benefit to the community is going to be related to staffing. What is it that you're going to get done that you're not able to currently do? So we are planning and we are listening and connecting the dots as we meet and we get feedback for that. So I think your point is really well taken, and we want to be, and we are accountable with the funding that we receive to make sure that we are describing and reporting out not only on outputs, but the outcomes that are connected to all of the activities.
Thank you.
Other Board of Health member comments? Yes.
Yeah, the vast majority of this funding, as you point out, is for the A1 and workforce enhancements. With the difficulty of hiring, and we've heard about that earlier today, vacant positions, difficulty in hiring. If we're not able to fill all these positions, is there any kind of penalty for not using all of these funds within 5 years?
So I do have confidence that we're going to be able to leverage this funding to address that issue. So one of the things, too, through the A2 foundational capabilities is also looking at the pipeline. And looking at how do we partner with other institutions to address that in a very proactive and active way. So that's one component. The second piece, addressing your concern, is that when we look at this funding, there are a few new positions, but there are also positions that will continue through these funds as well. So I do have a high level of confidence that we won't run up against that issue. Now, yes, go ahead. With our current CDC health disparities funding, we've also been able to receive a no-cost extension because nationally agencies have been experiencing the issue around hiring as well. And so there is that flexibility in the funds.
I think, currently where we're seeing challenges are hiring nurses. That's something that continues to stay steady, and we are taking some actions to make sure that we're trying to improve that. And we are also in conversations with the University of Colorado Springs on how to create more of a pipeline, and so we're going to focus on some of that. And I see our Human Resources Director for the county, Xavier, and he's also taken action as it relates to some budgeting and got approval through the Board of County Commissioners for talent acquisition specialists, and that's even going to further help us in public health to be stronger recruiters. And the county and public health, we have been, I think, more than ever intentional about retaining and maintaining employees and professional development. So I'm liking what I'm seeing, and so I'm hopeful that we're going to be able to excel with hiring and recruiting and maintaining in 2023.
Okay, I appreciate all of that, but if we don't hire enough people to use all this funding, does the funding just go unspent, or is there a penalty for not utilizing the full breadth of the grant?
At this point in time, CDC has not communicated that there is any kind of penalty for not expending the funds.
All right, one additional question. If we hire new positions, what happens 5 years in 1 day? Do we have to end those positions, or in that time are we going to be looking for sustainable funding elsewhere?
We are always looking at how to sustain all of the positions that come on through grant funds. Sometimes those positions are dependent, upon a very specific event. So the conditions always vary. But in terms of from the development office perspective, we're always, from the moment that we are awarded a grant, we're looking at the sustainability plan as part of that process.
Okay.
And I also think that's where the Board of Health comes in as well, and I hope to have much more engagement in 2023. And what I've been saying about this funding is that just because we're getting this nearly $8 million grant does not mean that we don't need county funding. We still need that critical needs funding. We still need non-categorical funding because the majority of our funding comes from grants and contracts, and it's very limiting when you're trying to build that base. And I think that that's the point that you're making as well. And then, for staff that are hired, what do you do in 5 years? Also, there is an effort with Colorado public health directors as well as the state health department to extend and increase the state per capita funding, and that goes to core services, and that's where I'm going to need a lot of help related to reaching out to state electeds to help them understand why that funding is so important. Because anytime we hire someone through a grant, sometimes the strategy is not to continue that grant. The strategy is to either continue to make it sustainable, whether it lives in public health or whether it goes to a community partner, and then that effort is sustainable.
What are the requirements from the CDC in order to fulfill this grant? Do we have any deliverables or things like that they require of us other than providing, creating these?
One of the deliverables is to look hard at the workforce, to look at the representation of the workforce in terms of, does it mirror, does it look like the community that's being served? Are you taking actions that support that? One of the requirements of this proposal is to also hire a workforce development director. That was just to even apply, you had to commit to that, and we do have, that currently in motion, and that will also support some of the concerns related to hiring in the pipeline, as well as retaining staff over time with professional development and opportunities. And so a part of this grant, too, that's unique is we're developing the data management plan over the course of the next 6 months alongside CDC. So they are working with us on those points.
Thank you.
And I also wanted to just mention that any grant that we get, it's very comprehensive, and the funding that we apply for, there has to be a scope of work and an evaluation plan to ensure that our agency is accountable with the funding. And so that it requires reports. It requires, there's a lot of different requirements that it has, and we could dive into the detail, even with, a retreat or at a later time. But I do want to make the point that there's a lot of deliverables related to scope of work, and you've got to hit those deliverables and be accountable for the funding.
Good questions, yes. Councilmember Donaldson.
Yeah, thank you, Mr. President. Can you explain it maybe in more clear terms? under the synopsis, it looks like the objective of the grant is related to workforce readiness, but then it sounds like it's a lot of analysis to determine the optimal workforce capacity for a public health agency serving a county our size, what services we are lacking. Sounds like we were trying to determine that, what our future needs are. These 15 employees, are they analysts like that? Like they're looking and trying to determine these things? Or are they providers providing care?
The FTEs that are encompassed by this funding it's really diverse. Some of them do provide direct services. Some of them are at the higher level.
For me, could you break it out a little bit? Like we're going to have 10 nurses, one new director, or is this going to be presented somewhere else and I'm getting too much into the details?
We can go through all of the positions funded through this proposal if you would like, or we can do this at a later time.
If it only takes a minute to read them, I'd be interested to see what we're getting.
Sure. Yes.
I guess there's a CDC. There's a grantor, I guess that's the word. There's a CDC dictate which positions we need to hire, or is it up to us to decide what positions we need?
Yes and no. So the CDC has required that we hire a director for the workforce, a workforce development director. That was one position that was required. The second requirement was that we also attribute FTE to the management of this proposal. Okay. So for this grant, I'm a 0.5 position. I'm funded to assist in managing it. Jordan Linder, our grants coordinator, is also, her 1.0 FTE is also covered by this grant. We have the workforce director. We have a new position, which is the environmental health program manager that is funded by this grant. We have the HR business partner that is funded by this grant. We also have the executive administrative specialist, a strategic initiatives officer, a bilingual communications specialist, 3 community navigators, our OPHB community outreach coordinator, a behavioral health planner, a project management specialist, a workforce coordinator, an admin project management specialist, and a 0.2 of our maternal child health program manager. To note, all of these positions aren't necessarily new. Okay, so we do have 2 new positions through this funding, and then the other positions, as mentioned, are continuing on through this funding.
And we piecemeal together grant funding, whether it's the American Rescue Dollars or different grant funding that stops. So just for an example, as Carolyn said, many of them are not new. So when I mentioned the HR business partner that is existing, they're currently funded through ARPA dollars, but now they're going to transfer with this funding to continue to sustain that.
Okay. Yeah, thank you. So the 2 new ones are the workforce development director, and what's the other new
The
one?
environmental health planner.
What does the workforce development director, what's their scope of work? What do they do?
So their oversight is really to collaborate and coordinate with our HR business partner to look deep into the how our workforce is functioning, what are different, components that are surfaced and identified through the workforce gap analysis, how do we address those internally, really taking the charge and developing our workforce professional development plan, and also coordinating closely with our strategic initiatives officer. So we're really looking hard at how do we understand, how do we become more efficient? And also, how do we more effectively and continue to meet the emergent needs of our growing population here in El Paso County?
And I'd also mention, as an example, so in the field of public health, it's always evolving. So when we talk about clinical excellence and with keeping a healthy nursing staff, there has to be a focal point related to how do you achieve clinical excellence. And so the workforce director would be responsible for that portion as well. So there's a lot of different expertise related to population-based direct services. And one of the things that was evident, in the engagement survey is that staff want professional development, rather than, going to a YouTube to learn something quickly. It's more organized and intentional around what is it that, our community needs. There's a lot of parallel efforts, and then the workforce director will help strengthen those efforts to build our foundation even stronger as an agency.
Okay. Any other?
That's it for me. Thank you.
One quick question. Are we allowed to use part of this fund to increase salaries of our current staff?
We did not incorporate increased compensation within this specific proposal. However, Susan, if you want to talk about the work that's underway related to that.
So, with all of our grants, we incorporate planning to increase salaries. Sometimes the grants are flat. They've been flat for 10 years or whatever it is. So the grants that are able to accommodate increases, for example, there's just some that do and some that don't. And then we work with the county for increases in compensation as it relates to the salary survey. So hopefully that answers your question. Okay.
All right. Good questions all. Yes.
One more super quick question. Thank you. So you mentioned that we're one of 2 counties in Colorado that was eligible to apply for this. Do we know if the other county that was eligible did apply and receive this?
Yes, and that's Denver.
Excellent. And then giving some bigger contextual, I'm assuming it was fairly competitive. It required being eligible to apply. Do we have a sense of that network that you referred to of other grantees across the nation, of how big the scope of that is, big picture? And basically, if everyone who, what I'd like to know is if everyone who applied did get this. And I'd just like to know the bigger picture of what's going on with this.
Right, and so we were just notified of this award late November. So we had our kickoff meeting, if you will, last week, and that is when we start to see who else is engaged with this across, nationally, and get a sense of the numbers. I don't know in terms of applying and not receiving the grant. It was very specific in terms of following the directions. It was a lift. 50-page narrative. And so I don't know if every agency went for the funds or if they did it correctly. I do know that the state, Colorado, was also awarded these funds, which is a big deal for the entire state, especially for your smaller public health agencies that serve, our smaller communities. And so this is great news for the state as a whole, but I can definitely, get that information for you for our next meeting.
Thank you.
Mm-hmm.
Great. Any other?
Just one final comment.
Yes.
We've had a lot of questions, but I don't want you to take that as anything but enthusiastic. This is a big deal, and congratulations are in order. Applying for a grant of this size is not easy to do. It's very specific and requires a lot of detailed information to put in for those grant requests. So my congratulations to the staff that put in for it. I'm very grateful, and I hope we can use it all effectively.
Well said. Well said.
I do want to make one more comment.
Yes, please.
I think we need a strategy here because as the grant comes to an end, because this is about averages to $1.5 million per year. And I don't think our county can sustain that in year 6. So I think we need a strategy as to how we, what can the county sustain, and then beyond that, how we're going to, I hate to say it, downsize because this is kind of a boom and bust situation when you get a grant this large. it puts you in a situation where, wow, it's like any of our businesses. I'm going to give you $8 million for your business. Who's going to turn it down? But then after the money's spent and you're used to spending at the $8 million level, it's like buying $1 million home and paying mortgage, and now the money's gone. So I want us to have a strategy in place so that once that that rate of $1.5 million that we have for the next 5 years is gone or dries up, then we say, how much can the county sustain and is willing to continue? And after that, what's the plan for the balance of that? Because, again, that just puts us in the hole. Right now, again, we're struggling to hire our people, and so this, I don't know what how well we'll be able to accomplish all of the hirings here, but at the same time, you hate to hire someone and then say, well, now we got to let you go because after a few years. So I recommend putting a strategy at the beginning, not wait till the end till it happens. Do it at the beginning, so that way we understand what happens when the term expires.
I would say fortunately or unfortunately, in my time, we've had ebb and flows. Back in 2000, we had 251 FTE. And then before the pandemic, we had 148 FTE. And then we went to the county commissioners for some critical needs funding and then increased to 158. Currently, we are at 201. And with these, and this does not include the additional positions. In the height of the pandemic, what we had done was contract out services, and then we also hired some, but we also, we have to follow the work related to being accountable with the tax dollars and justifying what we do and how we're doing it. So when, at the height of the pandemic, and we had a lot of contact tracing, case investigations, and those kinds of things with our staff, if we didn't have that work anymore, then we have to reduce. And so we do plan for the future. And I think that what that's going to take is recognizing our current plans related to accreditation, community health improvement plan, our community health assessment. We are required to have a workforce development plan, which all of our plans, end in 2022. So 2023 is really going to be the year where we're putting those 5-year plans together. And having a Board of Health retreat, I think, will be very helpful so we can really dive into the weeds so you can all get the detail related to what that future looks like for public health, and then get your input and comfort related to the strategies that we are planning to implement. And then I would also say that I really want to engage the Board of Health in 2023 related to going to the state and sustainable per capita funding, because that is going to end here soon. So it's a constant effort of trying to catch up and get funding. But what I will tell you is that, our folks are kind of primed that way, and I think that we're pretty good at that. But I also think that we also have to have the what-if plans, like you're saying. And so I note that, and I think that those are really important points that you bring up.
Very well done. Thanks for your time. You said earlier that this was unprecedented, and it certainly is. So unless I'm seeing any other hands or head nods, I personally would like to move that we accept and approve this new contract, strengthening U.S. public health infrastructure, workforce, and data systems, contract amount of $7.8 million, and I'd entertain a second.
Second.
All in favor?
Aye.
All right, well done. Thank you. Okay, we have another one. And this one is not quite as exciting, but perhaps if you're the program director, it is. So we're going to talk about the USDA Regional Food System Partnership, which sounds pretty good. This is funding from United States Department of Agriculture to the tune of $147,000. Okay, please. Oh, you're still up. Hi, Carolyn.
I am. I am still up, and I'm still representing our development office. So some of the work that we do, as I already described, is, we drive a funding opportunity, like with our CDC infrastructure funding. Part of our work also involves working internally with many of our amazing staff members within our agency who are really specialists in key areas. So if I can pull through a theme from our last discussion, it's really about resilience. And this particular grant is looking at how do we build out a resilient food system, knowing what it is that we know now based upon our experiences over the last 3-4 years, but also based upon the work that we've done previously as a community. So I do want to note that a key significant percentage of requests that came through within the work of our community navigators was around food insecurity. And so food insecurity is an issue that persists within our county. So this grant is through the USDA, and it is really focused on partnerships. It is a planning and development proposal over a 2-year period. Once we get through the 2-year period, I am going to say that we will meet all of the deliverables that are integrated into this proposal. Then we become eligible to apply for implementation funding. Okay, so this grant really does capitalize on partnerships, looking at a collaborative effort with higher ed, UCCS, the CU system, and also with Colorado Springs City. Within this partnership, this is named the Central Colorado Food Shed Partnership, and those partners are listed there. So through this proposal, it's about cross-sector collaboration. And a main component of this is to promote awareness about what it means when we really focus on locally sourced food in terms of the market potential, identifying that entire system. So as El Paso County grows, and as many counties grow, what happens is as those urban spaces start to take up those other spaces that were really dedicated to agriculture, there starts to be an issue and an impact to the food system and how it operates. Knowing that really food is a basic need. When we look at locally sourced food, it is a healthier option for many, but it isn't also always accessible for all. So this partnership is looking at what has been studied and analyzed in the past, and then moving that forward through several activities and several different areas. So here are partnership objectives, going through 1, 2, 3, 4, and 5. This is inclusive of an assessment period, analyzing that information, and really determining where the gaps are. And then taking that approach and starting to implement some key actions that pulls that information together in a very coordinated way. This funding and these activities will then start to initiate what this could look like for an implementation phase, and will set us up for that next level of funding through the USDA. And the impact is when we look at food insecurity and we look at different populations that are very impacted by this. We're looking at our homebound seniors, for example. We're also looking at our veteran population. We also know that through our response effort within the pandemic, those who needed to isolate and who were quarantined, there were issues sometimes in just being able to get food delivered. So it is a systemic approach, it's a coordinated approach, and it is really based upon leveraging key partners, understanding that that's the only way to move forward to address this issue. And here is a budget breakdown that we have for planning and design. We were able to apply between the range of $100,000 to $250,000. Our entire request is for $147,084. We do have an indirect rate. We use the 10% de minimis because this is through a federal agency, and that indirect rate is listed. And there is a match requirement that from our agency really translates to time and effort that's involved with this proposal. And I believe that is it.
Is it?
So,
Okay. Well, now that you've explained it, it is exciting.
it is
And-
exciting,
and,
yes, yes.
So thank you.
It's not
But
millions and millions, but it's
no,
good
but
funds
it-
for
food-
really
food
good
resiliency.
funds. Yes.
Absolutely. Okay. Questions from board members? Yes, Doris.
I do. So I know that you said that the proposal will be working on identifying gaps. It's a planning grant. And so also will you be identifying solutions so that when you apply for the implementation grant, you've got those solutions and you're ready to go?
Absolutely. So it's really taking what's been identified through previous studies, those key areas, digging in and delving in deeper, and then looking at how to address those issues as it relates to our region.
Okay. Yes, please.
Yes, as you're probably aware, the agricultural industry is heavily dependent on water supply. In fact, 85%, if I think my numbers are 80 to 85% of the water that's consumed in the state of Colorado is agriculture. How can we, what's your proposal of expanding the food supply through agriculture without negatively impacting water supply that's necessary for the rest of us to survive on just day-to-day, operation?
So Marla Lucky is our subject matter expert and really a key driver in this grant. So I'm going to ask you on that.
Sure, thanks. Good morning, Carolyn did an excellent job presenting. We are very excited about this grant with this partnership. This is a really unique opportunity to bring our local city and county government together with higher education. And really our subject matter expertise, to your question, which is an excellent point, is with our Colorado State University Extension Office representative on this grant. And so she is deeply embedded in technical expertise, teaching all of our agricultural producers, not only in El Paso County, but also Pueblo and Fremont, and knows this region very well. So she is involved in a lot of ongoing education around the water crisis and issues in our state. And so part of this plan involves focus groups with our agricultural sector and these farmers in our region. And part of what builds into our resiliency and understanding in that food system is how this water crisis and those water impacts do have an effect on our ability to sustain a resilient food system. So that's part of the assessment work and things that are very much on our horizon.
Good question. Any other questions about this? Yes, Councilmember Donaldson.
Yeah, Mr. President, I'll phrase it in a few questions, but then I'll just have a viewpoint or a statement. But does public health work do anything like this right now? Seems like we're trying to guide food development or the growing of food locally.
Public health, we have many of our community navigators who work within our community to address needs, and oftentimes those needs do relate to food insecurity. So understanding that then from a planning perspective, how do we take a step back and really be strategic and look at it from a systemic vantage point? So we are partners with many, many different agencies. For example, Care and Share, Because I Love You, and there are lots of different entities that are operating within this space to address food insecurity. But from the systemic vantage point, how do we then become a convener and learn from this work so that we know how to better address the needs of our community? So in that regard, we do provide a lot of resource navigation as it relates to food insecurity. And then we also dedicate personnel to the effort of understanding the system as a whole in terms of planning. It's an aspect of public health.
So we will be creating the Central Colorado Food Shed Partnership. Is that correct? So without more information, to me, this sounds like the El Paso County Board of Health is now branching to something completely new, creating a food shed partnership. As I sit here this morning, I don't think it's a good idea. I think we need to at least have a presentation on this next month and really think about what we're doing. This is a proper function for the Board of Health. Inspection of food has been a traditional function of Board of Health to make sure the food is is safe. But this seems to go much beyond that and actually into more creation of a new thing. I don't quite know how to characterize it. That's my concern.
Thank you, Mr. Donaldson. And maybe you could help provide a little bit more information on this, but public health is a convener in the framework of 3.0. So, for example, we continually bring partners together to address issues in the community. Whether it's teen suicide prevention, we didn't have an organized effort before 2014. It became evident that we had a serious concern, and then we convened partners. And for whatever issue it is, we have some ongoing critical impacts after COVID related to people experiencing food insecurity. So with this, maybe you can explain a little bit more about this grant, because we are convening. We are not going to lead the efforts related to establishing, how folks are going to grow food or those aspects, but it's more about bringing the partners together in a more organized way than is currently happening, and then determining what, based on the feedback and the stakeholder process, which is pretty involved. And public health is, again, the convener, but we're not driving it. And many times when we're on collaborative efforts, we are very intentional that we don't own it, but it's more about convening and then determining, what is the best approach for that. And so that's my understanding of it. And so it is more of what we do related to being a chief strategist in a population-based framework for public health. And so maybe that might be helpful if you want to talk a little bit about that, because my understanding is that these folks, they already exist and they're already meeting, but this is more of an organized approach related to even having some funding to help this effort out.
That's correct. And our role through this proposal is as a convener. And through that, and as you alluded to also with Public Health 3.0, determinants of health encompasses access to nutritional food, right? And so one of the key aspects that was realized during the course of the pandemic is the impact of food insecurity and how that became more pronounced within certain segments of our population. And how do we take an issue that has impacted the public health of our community previously? We've also worked with previous studies in the past, but that was all pre-pandemic. So how do we look at the data that we're able to analyze as a public health agency and really contribute to the system as a whole in El Paso County? We have many different entities, agencies, nonprofits, small and large, that work with this, but it's not always a coordinated effort. And this is really designed to be a coordinated effort to understand on a deep level how do we address this from a systemic vantage point, and how do we as a convener also learn from the information that's gained from this process.
Okay, yes. Commissioner Bremer first. Yes. Did you have a comment?
I do. I can appreciate Councilmember Donaldson's viewpoints on this, but to me, I would argue that being the convener and playing that role of facilitating partnerships and sometimes spinning them off and sometimes deciding that they're very core to what public health might or might not need to do in the future. I think this is pretty key to knowing whether that's the case or not. And, our director started off talking about partnerships and receiving an award for facilitating and convening that with kind of a bigger look. I think that's pretty key. And of course, this board and all of the people who will sit in our seats in the future, the grant we just approved, most likely none of us will be sitting around this table as policymakers at the time that grant is completed. But we do have the opportunity to kind of strategically direct. And I think, this is an area that we do know a good bit about. We know about the slide that's up right now shows the exact impacts to health that go back to our strategic plan here, and core determinants of health. So I think it's pretty key to know what we don't know and to begin to facilitate knowing who will in this community step up and make sure that the needs of the community in the food security area are stabilized for many, many years to come. So that's, again, I can appreciate the concern with the focus for staying in our lane, but I think convening is our lane and that this is an area that clearly our community needs to know more about. The other thing is, as I look at these partner organizations, I'm assuming that we're the applicant and the fiscal agent, and are the indirect, the 10% indirect then is coming to this entity?
That's correct.
To carry out that facilitation and to explore. I don't want to belabor the point, but I think that public health in general is uniquely equipped to really analyze, to see where we are now. We're very, very good at that, and the data and analytics team and all of the research-informed tasks that public health is very used to doing. I can't think of another entity that is going to be that data-focused in doing what our community needs for this. So I think that this, for now, in the exploration phase, is the place for this to sit.
Good. General Briggs, with your work with Springs Rescue Mission, you know a great deal about food insecurity.
Thank you, Mr. President. And I appreciate the fulsome conversation because I do think this is a very important issue and that we should go into this eyes wide open. And being a practitioner every day of food insecurity, I can tell you the impact of having healthy, fresh food for people who maybe are not getting clean nutrition is very important. And I want to compliment our county and our farmers and our ranchers who sacrificially provide, in some cases, for those in need when it comes to food. I would offer maybe just a slightly different perspective on why this might be the perfect place to have this kind of conversation where we look more deeply into these impacts. I love the impact slide, by the way, and your 3 bullets. I think these are 3 areas to really focus on because it's the department that would do the work of looking through this and maybe creating the next steps that would then be implemented, maybe not through the department, but other organizations, which I think is probably the path this would go through. And in the remand of public health, I think food is part of that. What I also think makes this particular place a very useful place for this is we have county commissioners, we have city council members who can also take this information back to their levels as they look at county and city development. When we talk about annexation of land, if we talk about water that you brought up, Trustee Stevens, all of these things, the information that I think a study like this can provide will provide decision makers who are at this table on the board to then take that back to their other responsibilities and factor those things in as they look at discussions and decisions at that level, so that we do look at what is, quite frankly, a system, not just an isolated thing if we want to get more food. That's my perspective on that. Thank you.
Very good. Thank you. Any other comments from board members on this contract? No? Oh. Yes, Lori.
I'm not a board member, but
You're welcome.
I would just like to provide a little bit of background with, of course, not weighing in on the policy perspective. But I just wanted to remind the board that state law does require every local public health agency to adopt what's called a community health improvement plan. And I believe that's done every 5 years, and Susan can correct me if I'm wrong. But it's a process that every local public health agency follows after adoption of a state community health improvement plan. And the one that was adopted by El Paso County Public Health in 2018 to cover 18 through 22 identified two priorities to focus on, one of which, and I'm summarizing, is mental health, and the other is healthy living and food, not insecurity, but
Healthy eating, active living.
sorry, healthy eating and active living. So those were the two priorities identified in this agency's plan for that time period, just to provide some background there.
That's right. Pretty fundamental to what we do. Okay, I think we have, yes.
I'm sorry, just one more comment. Commissioner Donaldson, thank you. Your question spurred additional conversation that was important to me. It's important to me to understand that this is to convene, facilitate partnerships. As I read through the information provided, it sounds like there's a lot of education and really getting organizations to increase access to our community, and I appreciate that. I appreciate the question that brought that more forward in my thinking. Thank you.
Okay, any other comments?
Mr. President, I do have a question. You know, food insecurity, I hear this phrase tossed around a lot now. What is food insecurity? Can you define it for me, please?
Food insecurity is essentially you don't have the resources that you need to provide food to sustain you and your family. Okay, so when you think about food insecurity in the context of this proposal, we're also looking at resilience. And so the flip side of that is, how do we look at building out a food system resilience so that food insecurity is then reduced? So what does that look like in K-12? It looks like children arriving to the building and they're hungry because they haven't eaten all weekend. It looks like homebound seniors who aren't able to get out and aren't able to, have the resources to really have the nutritional meals that they need to sustain their health. So those are a few examples.
If we talk about building resilience into the food system, again, that does not seem like the area of expertise of this board or even our core function. That is an agricultural area, and I'm sure there are people better than us to address that. And I suspect the answer will be, well, we're just going to convene and somebody else will figure it out. But why are we the ones convening it? And then, two, the other issues really seem to be a matter of economics, of economic development, not so much the focus on the food, but the focus on the economic status of families, of members of our city or county, how they're doing economically. If they are doing better economically, they can afford food. They can purchase the food. So, again, I just think this is not really Board of Health core competency or core function, so I won't be able to support it.
Okay, let me make a comment. I respectfully disagree. And being a professor at a university where we teach public health, food insecurity, and addressing that need of food deserts and children, as you say, who go to school hungry is a fundamental public health issue. So we may not be unanimous, but I think we've had a fulsome discussion of this particular new contract. So at this point, what I'd like to do is ask for a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
Any against?
Nay.
Okay. Thank you very much. Good job.
Thank you all for your time.
Okay, let's see, moving on. We have a big one here, our 2023 budget presentation. Now, we've heard this a couple of times before, right?
Yes.
And so this is the polished version, and you're going to tie it up with a bow for us, please.
Yes, exactly. So we are bringing forward a resolution to adopt and appropriate the 2023 El Paso County Public Health Budget. I have two attachments that I'll go through, brief presentations that tie to the resolution presented. And we did go into a lot more detail in October with the preliminary balanced budget. So this today will primarily deal with any changes between the preliminary budget and the final budget for 20.
Just for a question, how many slides do you have?
Just 5, I think.
Okay.
Next slide. Okay, what this shows here is, this outlines the changes between the preliminary and the budget that we are presenting today. The primary changes for revenues, they increased $483,000 due to the two grants that you've seen previous. The USDA grant, we're increasing in 2023 of $77,000, and the CDC infrastructure grant, an increase of $406,000. And these both are multi-year grants. These amounts are primarily just the amount that we anticipate using in 2023. The increase to the expenditures, $457,000. Those are the corresponding expenditures to those increased revenues for those grants. So ultimately, we are looking at a total budgeted use of fund balance of $225,745. This does keep us well within the minimum fund balance policy range of the 18 to 21%. We're looking at estimating about a 25% fund balance at the end of 2022. Okay, and this is kind of a summary of what the 2023 budget is. Total revenues, $31,131,180. This gives you a brief breakdown of what those revenues are that make up that revenue budget. The El Paso County funding, this does include increases for 2023 of roughly $100,000 for compensation, as well as a 7% personnel increase of about $1.1 million. 5% of that is the COLA, cost of living increase, that was approved by the board by the Board of County Commissioners in December. Expenditures, total expenditures, $31,356,925 for an ultimate change of a negative fund balance, or spend into fund balance, of the $225,745. So this just gives a graphical representation. You can kind of see COVID grants are broken out. Those are time-limited, restricted funding that is not sustainable long-term. So this gives you a total breakdown of what those revenues are, totaling to the $31,131,180. Next, we have a similar slide, graph showing the total breakdown of all of the expenditures. As is typical for a service organization, personnel is the largest part of the budget, so we're seeing that at 66% of the total budget. And then lastly, this is just giving a breakdown in a little more detail as far as where the operating expenditures are occurring, primarily in contract services of 48% and 22% towards all of the supplies, services, expenses related to all the specific programs for public health. So are there any questions on that presentation?
Any questions from Board of Health? We've seen this a couple of times before, but thank you for this presentation. Very, very clear. Yes.
Just
Super quickly. Given that this is a public budgeting process, did we receive any public input or any changes from the last presentation of this?
Good point.
Nothing from the public. The only changes that you saw are the changes that we had from a budget perspective for those new grants, but we did not receive any public input.
Thank you.
Well, let me just open it up to people who are here in the room. Are there any members of the public who wish to comment on our budget? No? Okay. I think we could entertain a motion. Nope, let me read it. I'm sorry, I'm jumping ahead. So this is a resolution of the El Paso County Board of Health, resolution to adopt and appropriate the 2023 El Paso County Public Health Budget. Whereas pursuant to Sections 25.1.508 and 511 and Section 29.1.103 Colorado Revised Statutes, the El Paso County Board of Health has the power and duty to adopt a budget for El Paso County Public Health for fiscal year 2023. And whereas Public Health has recommended that the Board of Health adopt a budget for fiscal year 2023 as indicated in attachments A and B, which you have, hereto and incorporated herein by reference, and whereas the Board of Health has conducted a public meeting to consider adoption of said 2023 budget and has received and considered public input regarding said proposal. Now therefore be it resolved by the El Paso County Board of Health that the Board of Health hereby adopts the fiscal 2023 El Paso County Public Health Budget as indicated in attachments A and B, which is incorporated herein by reference, and that the fiscal year 2023 El Paso County Public Health Budget may be amended from time to time by appropriate action of the Board of Health. Okay, I'd entertain a motion to approve.
I move approval.
Second?
Second.
All in favor?
Aye.
Any opposed? Okay, let's move on to our next item,
Thank you.
which is,
Mr.
well,
President,
thank you,
Mr. President.
Appreciate it.
Mr. President, could I ask one alibi question?
Sure.
Wish I had asked earlier. Could you just remind me, when do the COVID funds run out, what we have in the...
Some of those, it varies. I think by the end of 2024, those would be finished.
Okay, but some earlier, so some this would be the last year
There's a couple
for-
different grants that end at various times. ELC,
Epidemiology Laboratory Capacity Grant, I believe, runs through 2025.
okay, so it would be 2025.
2024.
Okay, okay.
So we have a timeline. There's numerous grants with different timelines. Why don't we get back to you with on that, but they don't end in 2023.
No.
Okay, so the earliest is 24, thanks.
Yes, yeah, and we are strategically planning ahead to tie all of these expenditures to the ending times of those grants.
Good job, Samantha. Thank you. Okay, next item is pretty perfunctory. It's the Sunshine Resolution, and we get to publish when we're going to meet and advertise that to the public so they can join us. So I think at this point I could probably just read that. Resolution to the El Paso County Board of Health, whereas the El Paso County Board of Health is a local public body subject to certain requirements of Section 246402 Colorado Revised Statutes relating to public meetings, and whereas the Board of Health is required by said statute to designate at its first regular meeting of the year a place or places within the boundaries of the local public health body for posting of public notices, and whereas House Bill 19-1087 went into effect on August 2nd, 2019, and allows local governments, to satisfy meeting notice requirements by posting on the local government's website. Now, therefore, be it resolved by the El Paso County Board of Health, the official place for posting public notices of El Paso County Board of Health meetings and other public notices for the year 2023 shall be on the El Paso County webpage under upcoming meetings. And there is a link there, a URL. And the El Paso County Public Health webpage under Board of Health meeting schedule. and there is another URL. Public notices may also be posted on the internet and other locations as determined appropriate by the Board of Health or its secretary. And the Secretary of the Board of Health shall be the official custodian of the minutes of the Board of Health public meetings, requiring such meetings. The office of the Secretary of the Board of Health is located at Citizen Service Center, 1675 West, Garden of the Gods Road, Suite 2044, Colorado Springs, Colorado 80907. Questions or comments from Board of Health members about the Sunshine Resolution? If not, I'd entertain a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
Any opposed? Nope? Okay. So the next one that we get to do in December is the publication of the 2023 regular meeting schedule. So I'm going to read this as well. Whereas pursuant to Section 25-1-5084BI Colorado Revised Statutes, the El Paso County Board of Health, hereafter known as Board of Health, is required to meet in regular session at least every 3 months as may be established by resolution of the Board of Health. And whereas the Board of Health desires to establish its regular meeting schedule for calendar year 2023, now therefore be it resolved by the El Paso County Board of Health that the El Paso County Board of Health shall conduct regular meetings during calendar year as follows. And these roughly work out to the last Wednesday of each month. Okay. Wednesday, January 25th, Wednesday, February 22nd, Wednesday, March 22nd, Wednesday, April 26th, Wednesday, May 24th, Wednesday, June 28th. We will typically skip a July meeting. Wednesday, August 23rd, Wednesday, September 27th, Wednesday, October 25th, and Wednesday, December 13th. Meeting dates, times, and locations are subject to change or cancellation due to inclement weather or operational considerations. Special meetings of the Board of Health will be scheduled as necessary. All regular meetings will be held at the Citizen Services Center, 1675 Garden of the Gods Road, Colorado Springs, Colorado, unless otherwise announced. In all Board of Health work sessions, public hearings, regular meetings, and special meetings are open to the public. Questions or comments? If not, I'd entertain a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
Any opposed? Okay. Now, we are getting into some leases. No, we're not. We're going to do election first. And so, let me start with a little bit of preamble here, is that I have had the good fortune to know Fire Chief Ted Colas for, well, at least a couple of years, right, as you served on the board. And I find him to be very professional, even-handed, measured, diplomatic, I might say, and very astute. But in addition, two things stand out about Fire Chief Ted Colas is one, that he gets public safety, and that public safety and public health, in my opinion, should be locked at the hip. The other thing that I would say about Fire Chief Ted Colas is that he's used to working with a large staff and a large budget, and has, I won't say infinite, but considerable connections within the city of Colorado Springs. So I would like to propose Fire Chief Ted Colas as president. But wait, there's more. I would like to propose Doris Ralston, who I've had the pleasure of working with for these last several years. And let me just say, Doris and I are partners in this, and that all the meetings that I get to go to, I think she's gotten to go to as well. And we've gotten to, working with Director Whelan, set the agenda and have fruitful and sometimes difficult discussions about the workings of the Public Health Department. And Doris has been absolutely faithful in fulfilling all of her responsibilities as Vice President of the El Paso County Board of Health. So I'd like to propose that she be also elected as Vice President for this next year. These are 12-month terms. And I think to finish it out, by Board of Health regulations, our Public Health Director, Susan Whelan, is our Secretary. So I would like to also propose that we elect Susan Whelan as our Secretary for the next year. Do we have a motion to approve that?
Mr. Chair?
Yes.
Before we move forward with that, I think it's appropriate to ask if there are any other nominations for those offices.
Fair enough. Any discussion on these nominations that I've just made, or other nominations?
And then, Mr. Chair, if we could confirm that those two persons are willing to accept the nominations.
Well, that's a very good
and
question.
stand up for office.
Fire Chief, how about it?
Yes, I appreciate it.
Okay. And Doris?
Yes, thank you.
Okay, and Susan, I don't think you have a choice. Okay. Any other discussion on elections for the Board of Health leadership for 2023? I've nominated a president, a vice president, and a secretary by Board of Health regulations. Is there a second?
Second.
Yep. Okay, thanks. That was Commissioner Bremer. Okay, let's take a vote. All in favor?
Aye.
Any opposed? Okay, I think we're done. So let's move to the next action item. And that is the approval of the lease for the renewal of City of Fountain occupancy at Public Health South. And Todd, thank you for being here. And I guess he's had to scoot, but providing a little background on this. Lori, could you provide us maybe just a little bit of background on this lease, and then we'll do it again on the agreement for leasing our spaces in the Citizen Service Center?
I will do my best. I may defer to Susan or another member of staff who may have more information if questions arise, but this is a lease for portions of the space in the building owned by the Board of Health down in the Fountain area that we call Public Health South. I believe that the City of Fountain has been using this space and proposes to use it for another period of time. And for code enforcement, police department, and Office of Emergency Management is my understanding, and if there are other offices, then someone please correct me. But the lease this is an extension, as I said, of an existing lease. We did write it in such a way that it doesn't need to necessarily come back to you every single year. So if you review the amendment, it says that it will automatically renew for one-year terms for 3 years, unless someone terminates it, or unless there is a discussion that the new operating costs or lease payments are unacceptable. And then at the end of that 3-year period, we would need to come back to you to renew it further. But otherwise, it can be handled administratively if both parties continue to be in agreement for the next 3 years.
Okay, so we're voting to approve a lease for 2 years.
3 years.
The City of Fountain as a sublessee.
Yes.
Okay, questions, discussions? Yes, Dr. Vu.
Can I have a small question, Lori? I like the automatic renewal. decreases administrative burden, but, so the lease provides for automatic renewal yearly for 3 years, but it also requires the tenant to give confirmation, written confirmation of renewal. So that doesn't make sense, it's slightly inconsistent to me. So the question is, what if the tenant remains silent? Then in my mind, that if the tenant remains silent within, 15 days or so, prior to the end of the year, then in my mind, that would also automatically renew, the lease will also automatically renew. So if you can please clarify that.
Sure. So to provide a little bit of background on that requirement for those who may not be familiar with the legal provisions, the Taxpayer Bill of Rights, as it's called, which is a provision of the Colorado Constitution, prevents a local government from entering into a multi-year fiscal obligation. That is why you typically see leases, contracts, any of these things for which we obligate funds are on an annual basis. And anytime, so that is why in this particular arrangement, because we have an automatic renewal every year, and because it is possible that the lease payments and the operating cost payments may change annually based on their share of the operating cost of the building, we are requiring written confirmation that they wish to renew the lease. The administrative savings here is that it doesn't come back to this body for renewal, but the tenant will still have to confirm that they wish to renew so that A, they are complying with Tabor, and B, to confirm that they are accepting of any increases in costs or decreases that there may be.
Great, thank you. So that explains a lot. So would it be appropriate to add a clause to clarify what would happen to the lease if tenant remains silent? If tenant chooses not to renew, that's easy. If tenant chooses to renew with a confirmation of renewal, then that's easy. But what if tenant forgets?
We certainly can if that's the desire of the board. And what I recommend, if that is the desire of the board, is that I would draft some language that says that if they do not provide that written confirmation, then the lease will automatically terminate. And
yes, terminate the renewal, I guess. I guess with the regulation you just mentioned that if that the city of Fountain is not allowed to automatically renew without a written confirmation, so then I guess the other option is automatically terminate then.
Right.
Then we should, if that's the case, then we should clarify that, please.
Okay, Lori, this sounds like this is probably going to take a little thought and perhaps some additional verbiage.
It would, Mr. President, but if the board is okay with it, you can still take an action to approve it today with an amendment to that effect, and I'll just come up with the language, or I can probably come up with it in the next couple of minutes, but you can still approve it today with that with that change, and then we'll send it back to Fountain to make sure that they're okay with that as well.
Okay, is there any legal reason why we can't take this up at the January meeting?
I believe the lease expires at the end of this year.
Correct.
Oh, okay.
I agree with your proposal, Lori. Thank you.
So what I would suggest, if the board is in agreement with it, that the motion maker, if you wish to approve this, approve the lease amendment with the additional language that was discussed on the record. You would direct me to come up with that language and then refer it back to Fountain for their approval. And then you would not need to see it again.
Dr. Vu, I think you had another question about the sublease and the second document. Maybe we could talk about that now as well.
If we, for the purposes of the record, Mr. President, I think it'd be more appropriate to cover that when we get to that item, so we're not confusing the two items. Thank you.
Lease agreements and extensions have tended to be somewhat lengthy, so by tradition, I have not read them into the record. This one, though, will be modified with the language as suggested by Dr. Vu and agreed by our county attorney, having to do with automatic extensions and renewals. Lori, do you want to kind of briefly restate that using your best legalese language, please?
I think you stated it
Sufficiently?
I think you stated it sufficiently, yes, thank you.
Sufficiently? Okay. Any other board questions, comments? Before we vote to approve this sublease with City Fountain at the south side.
Mr. Chair, I will move approval of this with the discussed adjustments, clarifying confirmation of renewal each year.
Okay. And we'll leave that to our county attorney to come up with the exact language, but that's certainly the intent. Okay, there's a motion. Do we have a second?
Second.
All in favor?
Aye.
Any opposed? Okay, and I think the eagle-eyed Dr. Vu, you read these very carefully, and I appreciate that. I think that shows good diligence on your part, and that is part of our work here. So would you comment maybe about the sublease agreement for the Public Health Department at the El Paso County Citizen Service Center, and what your question or clarification might be?
Thank you. Thank you. Maybe three questions/comments. Because, number one, because it is a sublease, I'm assuming that the landlord in the lease is not the owner. If that is the case, the question is, who is the owner? And if we should be explicitly incorporating that into the lease. Question number two is, would it make sense to also have similar automatic renewal language in this sublease? And the third question is, because if it is a sublease, then just want to make sure that the lease rate and the triple net is not higher than the master lease.
Okay.
To answer your first question, I believe, this is speculation, but I believe it is called a sublease because that is simply a carryover of language used when this building was not owned by El Paso County. For a number of years, the building was owned by the El Paso County Facilities Corporation, which is a nonprofit corporation created by El Paso County for the purposes of owning property for the use and benefit of county departments and agencies. And in fact, some of the county buildings are still owned by the El Paso County Facilities Corporation. This, I was able to look up, this building, it appears, did change hands and is now owned by El Paso County, not by the nonprofit Facilities Corporation. So the correct nomenclature would in fact be a lease, but it appears that we've simply carried over the language just out of habit. So no, there is no other owner. El Paso County is the owner.
Therefore, would it be appropriate to clarify that in the lease and change it to a lease and clarify the change in ownership, or does it really matter?
I don't think it really matters legally.
Thank you.
There were three parts to your question.
And the second was, does it make sense to have an automatic renewal language in here?
It may, but I believe that that would probably be a discussion for next year. This lease, because El Paso County leases to a variety of other elected officials and agencies in this building, I believe they typically use a standard lease, and if we wanted to change that, we would need to go back to El Paso County, because we are the tenant in this case,
Right.
and ask for that.
Thank you. And the third question is moot point because the landlord is now the owner.
Okay.
Okay, this runs on to 10 pages, so I'm not going to read it into the record. Any further discussion or questions, particularly while we have our county attorney here? Okay, my understanding is that we're going to vote to approve the sublease as written, as published in the record. Is that your understanding? Okay. I would entertain a motion to approve.
I would like to move approval of the El Paso County Citizen Service Center sublease agreement.
Okay, second?
Second.
All in favor?
Aye.
Any opposed? No? Okay, let's go on to our next business, which is the director's report. And you can take as much time as you want. Director Whelan?
Well, I think it's 10:30 also, and so I know that we we have a couple of areas that I wanted to highlight, but in the interest of time, we'll try to speed it up, if that's okay with some of our presenters. And I hope that, I'm just going to stick to two items. So Daryl Kirby, are you here with our emergency preparedness and response team? Please come up. And Janelle, please feel free, our program manager. I wanted to provide a little bit more information on our statutory responsibility as it relates to responding to the horrible tragedy that occurred at Club Q, to offer a little bit more information around that.
Yes, please.
Good afternoon, or no, good morning still. I'm Janelle McNair. I'm the Program Manager for Emergency Preparedness and Response. And I have with me here today Daryl Kirby, who's one of our Emergency Preparedness and Response Coordinators. Daryl was the lead team member for the Club Q response, and so he's here to talk a little bit more about how we were activated and the steps that we took in order to coordinate the behavioral health component support for this event. So, Daryl?
Oh, yeah, so as we know, on the morning of the 20th of December, we had the tragic event, and EPROEM reached out to El Paso County Public Health and specifically the EPR team and activated us to serve as the ESF 8, Emergency Support Function 8 lead for that event. And what a lot of our duties that we did that morning was to reach out to our behavioral health partners, bring those individuals in, and to reach out to a Colorado Springs Police Department victim advocacy team. They actually were leading the opening of a Community Resiliency Expo, which is going to open the next day at 0800. And also they had already started with the Family Assistance Type Center, where they had already reached out to the victims and the families of the victims and such. So we provided a lot of support for them over that first several hours of the event, as well as reaching out to our other ESF 8 partners, creating coordination calls and such as we responded to that, and also reaching out to our behavioral health partners from the state all the way down to the local level, immediately creating coordination calls and stuff as we move forward with that as well. The expo was open for 5 days, and then it closed. We made sure and reached out with communication teams and such. Michelle's back here. She helped out a lot with that, making sure that the information was being provided where people could go and individuals would get the behavioral support that was needed, early into this event. Since then, we have looked, as was mentioned, the long-term effects of a tragedy like this. We are working with partners. We have calls with local and state behavioral health partners still. We have calls with Diversus Health and other partners throughout the state that unfortunately have had to respond to these types of events as we're looking to develop a long-term resiliency center. For example, there will be individuals going to Boulder to look at the Resiliency Center on the 22nd, and then we're going to meet again on the 5th of January, really start looking to move forward to open up that center, where is it going to be, how is it going to be funded, what all should be provided there. Just so you know, a Resiliency Center is not really supposed to be a place where treatment is provided. It's supposed to be a resource where people can get together that were impacted by this event, a place that feels very welcoming, a place that feels safe to them, where they can, talk, they can be with other people that have been involved with these events and such. But these centers are typically open for years, so, we want to make sure it's in the right place and done the right way because it's going to be around for a long time. So I think that is a lot of the updates. I will say, with the team, I was the ESF 8 lead, but the whole EPR team pulled together, as well as other, like Michelle and her PIO team. Even members of my team that were on leave reached out and, provided support and such. Janelle reached out quickly, and Marini Klaber, who is in the back, I think here, reached out as well, because she's got, unfortunately, past experience on how to respond to these. So it was great, having all those resources came together as a team as we move forward with this event. I don't know if you have any questions, I don't know if, Bill, you were wanting to speak on your part, or
Any other questions about?
I have a comment if no one has.
Please, go ahead.
I just wanted to thank you, to our staff for the quick response. I mean, if you can remember when that was and waking up to the tragic news, oftentimes public health is working behind the scenes and you're not seeing some of the efforts, whether it's in a public format or on the news media, but we are highly focused and definitely involved in emergency response and play a critical role. I also wanted to just recognize Board of Health members that reached out as well, and sometimes I know that, our staff or the public doesn't see some of what goes on behind the scene, and I know Commissioner Bremer specifically, we reached out to our county partners, and then we're coordinating behind the scenes because there's a lot that goes into play, and, whether it's, coordinating, with our coroner's office or the district attorney and different leaders and working in alignment with our city partners. There's a lot that goes into it, and so I just wanted to recognize that it's something that has been devastating, and our hearts are heavy, and will continue to be, but there's also strength and some action, and so I just really greatly appreciate all of the efforts of our Board of Health and the leadership that you show in times like these, and then also our staff.
I just wanted to make a quick comment. I had the privilege of addressing the staff, the public health staff at a town hall recently, and was able to thank them for their rapid response. We responded to so many Black Forest, Waldo, the Planned Parenthood shooting, of course, an extended response to COVID, and I know I'm missing some other ones, but when push comes to shove, this agency, this health department rallies appropriately, compassionately, and very quickly. Let me just read what I said at the town hall. Public safety and public health are absolutely related. I'd like to say that we're on the same team. And your example during the Club Q shooting shows that you are indeed first responders, that you have these skill sets, that you're immediate in your response, and that the work that public health does overall helps save lives. So thank you. Well done. Appreciate you providing the update today.
Thank you.
Thank you.
If I could have Dr. Bernadette Albanese come up, we'll give a viruses update.
Viruses.
Way too many viruses. Hi, good morning, everybody. Nice to see you. Nice to see everyone not coughing or sneezing. That's really good. All right, so Susan asked me to just give an update on where we are with the respiratory season. Unless you haven't been reading any of the news, I think it's been apparent it's been a busy and brisk season. So we are experiencing sort of the trifecta of three viruses circulating at the same time. Pre-pandemic, it would have been two, but this year it's three because it still has COVID. So RSV, respiratory syncytial virus, is a common virus. It circulates. It's a winter virus. We see it every fall and winter. And for adults and most adolescents and school-age kids, it's basically anywhere from a mild to a nasty cold. Many of you may have family members or friends or neighbors that have done this. But in young children, it's a different ball game. Young children and infants have little bodies, little lungs, little air passages in their lungs. And when RSV gets in there, because that's where it infects, it clogs it up, and it makes it hard for them to breathe. It makes it hard for them to eat. It makes it hard for them to sleep. It makes it hard for them to function, and they end up getting hospitalized with respiratory distress, many. And so while for older adults, for adults and adolescents, you're like, I got a bad cold or whatever, when it gets passed to kids, and then kids pass it to each other, and then eventually it lands in a young baby, that's when we have problems. So in Colorado, we do a lot of tracking of RSV in two ways. One is counting hospitalizations of any age within the 5-county Denver metro area. That's a surveillance system we have up north. And then we monitor RSV outbreaks, and because it has a predilection to hit kids hard, it ends up being outbreaks at school and child care centers. So since October 1st, just north of us, we've had 1,700 RSV hospitalizations. Nearly all of them are in children. That's expected. The high number is not, but the fact that it impacts children is not uncommon. And we've had almost 400 outbreaks, which is actually extraordinary. And in El Paso County, I think we have about 50 now, but I think if we had the total of that, you know, a couple of dozen of all the outbreaks that we've dealt with really since the end of September, which is also quite remarkable. Next slide, please. So this is just a slide to show comparison of the RSV hospitalization curve in the Denver metro area by week. Actually, no, this is but this is in the Denver metro area week. So the very large pink spike is now, and the previous years are below it. And it doesn't take much to say it's different. This is a different year. It started early, it went up sharply, it's still really, really high, and we're not done. And in previous years, you can pick whichever other color curve you want on the bottom. It started a little bit later, it's not as severe, and it mellows out a little bit over time. And that the MMWR week is essentially a week of the year. So week 1 is January. If you work backwards, you know, you get into about October, September. So we typically would see activity in December, January, when we saw it much earlier. But it is coming down, which is good news. Next slide. This is pediatric hospitalization in particular, comparing RSV to flu and COVID. Also in previous seasons, this time you actually see the dates into a year ago into now. RSV is the green, sharp spike high, and down below it in blue is flu, and in orange is COVID-19. So it's a little biased because the numbers are so high for RSV. You can't really appreciate what's even going on with the other two diseases. But if you just go back a year on the slide to the left, and you can see the same curves, and you know, we would just see more equal play, particularly between RSV and flu, and we had more COVID generally last year. So thankfully it's coming down, but it's been busy. Our pediatric hospitals have been slammed, completely and utterly slammed. The providers have been slammed. And we're glad to be hopefully coming out of it, but we're not done, so we don't really know if this is just going to peter out slowly or come sharply down. Next slide, please. So let's move on to flu. This is El Paso County data that is tracked by our great EPI team. Also, sort of the same trend where these are cases of flu-related hospitalizations, which is one of the ways that we track flu very carefully. And you can see the weeks, again, starting in October, MMWR week 1 would be January. What's in the pink is El Paso County in this current flu season, and the other colors are the previous flu seasons. So we also had an early and sharp rise, which is very unusual. We typically see things get rocking in January and February for flu, and it's December, and we may be at a peak, we may not. That little dip down is probably fake, and just from some data lag of reporting, so we'll see. But there's no doubt this was a sharp early year. We'll see how things compare as we go along, but we have providers now dealing with RSV, we have providers now dealing with flu sooner than they expected. We're hurrying up, trying to get flu vaccine, and everybody to sort of see if we can change the shape of this curve a little bit, but it's been really busy. Next slide. This is the state data for state flu hospitalizations, and again, you can just see the red line is the current season. Again, not sure what that little dip on the top is going to mean, but an early sharp rise. And the blue, which also looks like a bad season, was actually for 2017-18 pre-pandemic. So I don't know if we're going to catch up to that in terms of the number of hospitalizations, but we'll see. But we're not out of this for a while. It's unlikely that the flu curve is going to come up and sharply back down. We'll probably be in this well into January. And of course, we're all traveling for the holidays, and so we expect this to just continue into January. Next slide, please. And then last but not least, our favorite really friend, be a friend, COVID, be a friend, is COVID. So on the bottom is the graph of our nightmare of an experience for the past 3 years, and what's happened. And so, we had COVID start to the left side of that green graph, and then we had our wave through, and then we had last winter our introduction to Omicron, which was wild and crazy, and then we had another blip in the spring. And hard to tell with the graph the way it is. We are having a very, very modest increase in COVID in the fall, modest. And hopefully it's been it came up and it's just been hovering and hovering and hovering. Not really high, not really crazy, not terrible unless you're the one actually who got infected this fall, and we're ill from it. But it's still cranking, and hopefully between a lot of vaccine use and just previous immunity from persons getting infected before, that we're going to get through this okay. It is extremely unlikely that we're going to see that blip from a year ago. That would really be quite extraordinary. I should probably just cross my fingers and toes and wish I never said that, but we're likely to hopefully just kind of get through this one. But again, it's co-circulating. So for someone who has a cough and a cold and a fever, there's no badge on you that says, well, this time it's flu, or this time it's RSV, and this time it's COVID. So you need to get tested, and of course we have treatment for flu, of course we have treatment for COVID, so it's good to get evaluated and get tested. That's the message we're trying to share, because there's something we can try to do about it to get you healthier, depending on your underlying risk factors. But they all spread the same way. Cough, sneezing, shaking hands, kissing, hugging, sharing utensils, drinking out of each other's cups, sleeping in the same household, traveling on airplanes. So just be careful. Be careful, take care of your family. If you're in high risk, make sure you're vaccinated, and it's okay to wear a mask if that is the way you feel for yourself, to protect yourself, and it will help. Next slide. And this is just data from COVID hospitalization, sort of the same thing, kind of just dipping and rising and coming down, but hopefully we're going to come out of this okay. And I think that might be the last slide. Oh, nope, last one. So we also track COVID through wastewater, because when you have COVID, you poop it. And when you poop it, it ends up in wastewater. And so this is data from the Colorado Springs watershed, sewer shed, I should say, showing how the concentration of virus has changed over time, over the past year. And of course, that big spike is our last winter. And so you can see here that we are really, people think, oh, there's no more COVID. No, there is. There really is COVID. We're having a little modest bump, but hopefully we're turning around. And then I do think that might be the last slide. Are we good? Next one? There we go.
Don't go away. Don't go away.
Okay.
I appreciate that you were able to be slightly reassuring, and that we are doing better than a lot of places in the country right now. So thanks for this update. Questions, comments from board members? Yes.
I have a completely uninformed question, so pardon me. Let's say you get like the regular flu, and while you're having the regular flu, can you get one of the other two?
Absolutely. And all questions are great questions, General.
No, this is a knuckle dragger question.
Yes, you can get them at the same time. You can get them one after the other. You can get them back to back. You can get them weeks apart. So unfortunately, the immune protection doesn't cross over, because the viruses are different. They really are quite different from an immune standpoint. That said, if you yourself or you know anyone who's had the experience of any of these and you felt kind of crappy, then I think it's just a fresh reminder that these are spread from person to person. So someone gave you the gift, but we don't want you to give the gift to others. So it's just a reminder that these preventive measures really do work, and washing your hands and staying away from others when you're sick. I see Dr. Vu is smiling. He'd like to have his office not so busy. And again, if the vaccine is a personal decision, but it does offer benefit. We do have data to show that. And I myself, I wear a mask on planes. That's my choice, and I feel great when I do it.
Other questions for Dr. Albanese?
Just really quickly, for her or anybody on staff who can answer this, with the closure of the drive-through COVID testing site at the Citadel Mall since we last met, what are the public's options for access to testing?
So for the most part, the efforts now are to bring COVID into normal, regular healthcare settings. And with COVID, we are lucky enough to have a home test. We don't have home tests for the other two viruses. You can get a rapid flu test done pretty quick at a provider's office. RSV is a little more complicated. Generally, the best tests are done in a lab. You can do a pretty darn good test at home. So there's right upstairs on the third floor. You can go pick up some free rapid COVID tests that we have at our reception area. So I think having the test at home for COVID for the pandemic, and it spills over into now, is to really empower you to at least have one option to try to test yourself, so that you can make good decisions about your own care and your own well-being, but also the well-being of the family and the other folks around you, in terms of trying not to spread it. But otherwise, it's going to be brought into the the routine medical care system. So I don't know if our EPR folks have any more to say about other availability of free testing in our community, but for the most part, we're trying to normalize it.
Yeah, so we do have a high-volume testing site that's available. So maybe, Janelle, you can offer some details.
Yes, so the testing site did move. It's at the Colorado Events Center, and that is right now scheduled to remain open through January 15th. So the community can still access that community-based free testing site until January 15th. And that information is also on our website.
And it's 3960 Palmer Park Boulevard.
And can, and on our website, where else they can get some free tests or home testing?
All the public health? So yes, all the rapid home test locations are posted on the website as well.
Do you foresee influenza rapid tests being available over the counter in the future?
Well, there's a lot of talk about it, right? So, I don't know. I didn't come prepared to know if that's going to happen this season, but I think generally the manufacturers are looking into that. I think, we learned a lot from COVID about a lot of things, and one of them is, how do we get more people tested so they can make good decisions for themselves and their health. So the technology really spring forward quite a bit to get a test you want a test that's reasonably accurate and reasonably easy to use, and so you don't have falsely positive tests or falsely negative tests telling you I don't have something that you do, or you do have something that you don't. So that's the science part of it. So hopefully we'll see some of that springboarding. But I don't know. I'll have to look, Dr. Vu, to see if there's something like almost ready for this flu season, unless you know in your practice. Yeah, but it's pretty easy to do it in the practice setting, So RSV, like I said, for little kids, it ends up going to a laboratory to get that test done. Yeah.
Other questions for Dr. Amini? Great update. Thank you very much. Appreciate it. Now, our Board of Health will need to go into executive session. We don't do that very often, but there's some logistics involved. So we'll ask, our Chief Financial Officer, I think, had to exit, but Xavier, the new head of HR, you're right there. Great. You stay. And if we could, let's go ahead and we'll excuse everyone else, to include you, Director Whelan.
Before we do that, Mr. President, there are a couple of steps we need to take.
Okay, please.
So I'm going to read into the record the executive session request. At that time, there will need to be a motion, a second, and a vote as to whether to go into executive session. State law requires a 2/3 affirmative vote, so that means 6 out of the 9 members present would need to vote to go into an executive session, and it's at that point that we would need to then excuse everyone but those who will be present for the executive session. So to begin, I'll read into the record that there is an executive session request pursuant to CRS 24-64024F regarding personnel matters pertaining to the annual performance review for Executive Public Health Director Susan Whelan. And so again, we would need a motion to go into executive session for the purposes stated on the record, a second, and a vote.
Thank you for keeping us legal. Okay, a motion to go into executive session?
I move we go into executive session for the reasons stated on the record.
Okay, a second?
Second.
All in favor?
Aye.
Aye.
Any opposed?
Do we need to close the current session?
Yeah,
No, we will do that after we come out of executive session.
Okay.
Mr. President, can we give a few minutes for people to get out of the room
Yeah,
and
we'll need to turn off the, let's take a public health break.
come back in
Dr.
at
Ahmed.
11?
Dr. Ahmed.
Now you're in for it.